Right bundle branch block means from the bundle of his, the right bundle branches is getting blocked, and the conduction to the right ventricles and the surrounding area is being compensated. Okay, normally this is the pathway from AV node, SA node to AV node, bundle of his, right bundle branch, left bundle branch. This is the pathway, Purkinje fibers. So here the right bundle branch is getting blocked here. This is the blocked area. The right bundle branch is getting blocked here. Okay. So the electrical current enter the ventricle through right and left bundle. Then we should understand that when the right bundle branch is blocked, the current will flow normally to the left side. So since here this is blocked here, it is blocked. So the current will flow. The current will flow naturally to the left side. Okay. So what will happen? So there is an initial deflection of QRS complex. After some time, the electrical current from left ventricle move to the right ventricle. Normally, the current will move equally, but here the right side is blocked, so the current will move to the left side. So we can say that normally the deflection is like this: T, P, P, Q, R, S, T. The QRS complex means the depolarization of the both the ventricle simultaneously. But if at all the ventricles are not electrically stimulated simultaneously, we have to know that the first deflection is the left ventricular depolarization. Then from the left ventricular depolarization, the right ventricle get depolarized, forming another complex. So this is two complexes. Okay, that is this here we can see that the rabbit ear or M pattern. See RS R dash pattern. We can clearly see here RS R dash pattern. The first R is a slow or the small positive deflection, then come the S, then come the strong R dash positive deflection. Both are the two deflections which are seen here. The waves are classically seen in V1 and V2. Okay, these RS R dash pattern are mostly seen in V1 and V2 leads. See R, S, R dash pattern. Okay, so in lateral reads like V6 and V5, there are slurring of S wave. What is slurring of S wave? Like this sloping of S wave, slurred S wave. We can see, we can clearly mark here. This is the slurred S wave, slurring of S wave. Okay, so the different type of slurring can be seen. It can be like this, it can be like this, or it can be like this, or it can be like this. So different type of slurring can be seen. So let's take the ECG. See the lead V6 as well as V1. In V1, we could say that there is clearly an R. There is an R, S, R dash, RS, R dash, R, S, R dash. That is RS, R dash pattern in V1. And in V6, see the slurred waves. See clearly, you notice that. Just pause the video and notice this is the slurred waves, slurred S waves. So this is typically a case of right bundle branch block. Okay. Next, just look at the another ECG here. We can see that the V1 lead is this one. This is the V1 lead, and this is the V6 lead. The V6 lead is quite not clear or short. You see the V1 lead, it is clearly shown that it is a R, S, R dash. Similarly, R, S, R dash. R dash R dash pattern is clearly seen in V1, and in V6. If you clearly observe that, we can see that the slurring of S wave. Okay, so V5 V6. See the V1 here. There is clearly R dash R dash pattern. R S R dash pattern. Clear R dash R dash pattern is seen here. R S R dash pattern. So this is a case of right bundle branch block. Another see this like the ECG. See the V6 lead. See the slurring of S wave here in the V6 lead. Okay. Also in V1 lead, just look here in the V2 leads. Also, this is the most anterior leads. Here we have RSR dash pattern. So this also here we see in V6 lead exclusively the slurring of S wave. So it's clearly a case of right bundle branch block. Okay. So coming to the next slide. This is the next ECG. In the V1, it is clearly it is RSR dash pattern. Okay, clearly it is RSR dash pattern in V2 also, in V3 also. See, look at the V6, there is slurring of S wave in V5 also. So it's clearly an right bundle branch block. Look at the another ECG here. See, in V1, we can say that there is a, of course, there is an R dash pattern in V1. Okay. In V2 also, we are seeing that R dash pattern. Next, in V4, V5, V6, see the slurring of wave, slurring of S wave is not prominent in V5 and V6. Okay, just see that the slurring of S wave is not prominent. In V5 and V6. So even though slurring of waves in V5 and V6 is not prominent, the V1 and V2 has a clear RS-R dash pattern. So it can be mostly due to RBBP. So we can give more priority to the V1 and V2 lead rather than the less prominent V5 and V6. So just concentrate on your V1 and V2. Okay, concentrate on V1 and V2 to see the RS-R dash pattern. Next, the causes of the right bundle branch blocks. Just by heart all those things and think about it also. Okay, like we could say that it is acute enteroseptal myocardial infarction, then acute pulmonary embolism or infarction, acute congestive heart failure, acute myocarditis or pericarditis, then hypertensive heart diseases, then it is congenital heart diseases. Okay, so first we should understand here the case number one. Case we are seeing an ECG here. See, we can solve it in systematically. First, we should know the general impression of ECG. Yeah, which means that every leads are placed it correctly and almost okay. So it's the general impression of the ECG is good. Then we should know the calibration. In calibration, see, this is the calibration given here. See, calibration. In calibration, we could say that it covered one square and two big square vertically. So it is calibrated at the rate of 25 millimeter per second. That is a good calibration. That is a standard calibration. Next, we check the rhythm interpretation. Just you see that all the P waves are followed by QRS. No missing here and there. All it has followed by QRS, and the regularity is also normal. So the rhythm is sinus rhythm. Okay, and it's regular. Okay, then you check the QRS. Firstly you check the R wave progression. In R wave progression, the precordial leads should be positively deflected. But here you can see the lead 1 and the lead 2 are positively deflected, but the lead 3 is negatively deflected. Okay, this is the lead 1, this is the lead 2, and this is the lead 3. Lead 3 is negatively deflected, all other leads are positively deflected. Then you see the AVR. Actually, you see the V1 lead. In V1 lead, it should be mostly negatively deflected, but here is bit positively deflected. Okay, so the R wave progression is very poor. Okay, the poor R wave progression. Then what you see the axis. The axis it's a we have a mnemonic like left leaf, right reach. Okay, in axis you check the lead 1 and lead AVF. In lead 1 that is positive deflection. In lead AVF it is also positive deflection. So we could say that it is a normal. If the lead 1 was positive deflection and the lead AVS was negative deflection, then it could be possible left axis deviation. If both are negatively deflected, it is extreme axis deviation. And if lead 1 is negative and the lead AVF is positive, then it is right axis deviation. So here the axis is normal axis. Normal axis is probably it can be 30 minus 30 to 90. Then bundle branch blocks. Is there any bundle branch block? You see the lead 1. You see the V1 lead. It is clearly there is an R dash pattern in V1. And see here is a dip. RSR dash pattern, it cannot be a complete RSR dash pattern. The dip in the QRS complex is also a dual, that is an unsynchronized ventricular depolarization. In V6, V5 and V6, you can clearly see the slurring of a S wave. So it is a right bundle branch block. Okay, we can write it as a RBBB, right bundle branch block. So finally, we can write. You just calculate the rhythm first. Rate. In rate, we have four big squares. So the rate will be 300 divided by 4. That would be 75 beats per minute. So this is a case of a sinus rhythm with a poor R wave progression, and he's having right bundle branch block. So this is the diagnosis of the first case of ECG. Okay, so next we look at the second case of ECG. So in case number 2, we'll discuss this case. First, you see the general impression. You can easily make out that it is the QRS complexes are a bit wider in chest lead. So it is looks wide. Then you can check the rate of this ECG. Okay, the calibration is it's clear. It is a two big square. The calibration is standard. See here, this is a 2 big square and one small square. Vertically 2 big square, horizontally one small square. So one big square, horizontally one big square. So standard calibration. Next, the rate. He could see that here we have three large boxes. Okay, so it will be 300 by 3. So that amounts to 100 beats per minute. In rhythm interpretation, there is P wave. Here in every P wave followed by QR. So it's a regular rhythm. We could say it's a regular rhythm. Rhythm is a regular here only, and sinus. Next, QRS complex R wave progression. R wave progression here, look at the V1, it is positively deflected. It should have been negatively deflected. And also just lead 1 is a positive deflection, lead 2 is negative deflection, lead 3 is a negative deflection. All should have been positively deflected. So it's a poor R wave progression. Okay. Next, the axis, when you're talking about the axis, check the lead 1 and the AVF. Lead 1 is positive, lead AVF is negative. So deflection. So it is left axis deviation. So it's left axis deviation. And check the bundle branch block. We could see that in V1 there is a notch in QRS. It's not an iconic RSR dash pattern. Also, you could see a notch. That is enough. The notch is enough to diagnose the RSR dash pattern. Here is R dash. In V6, we could see the clear slurring of S wave. So it's clearly defined that it is RBBB pattern. Okay, it is clearly defined it as a RBBB pattern. So this is a case of sinus rhythm at 100 beats per minute with poor R wave progression and having right bundle branch block. So like that, you revise this one. Keep in mind that in V1 it is even if there is a M pattern or RSR dash pattern, that is enough to diagnose it as RVBB. Sometimes the V6 may not show pure slurring of S wave. Okay, that is about the RVBB. Thank you so much.